I always had an interest in science, but I really liked working with people, and so that steered me towards a career in medicine. My specialty is colon and rectal surgery. We see a wide variety of diseases within that subspecialty, from benign, that includes anorectal pathology, things like diverticulitis, all the way to cancer involving the colon, rectum, and anus, as well as inflammatory bowel disease, which encompasses Crohn's, ulcerative colitis, and then pelvic floor disorders. And I liked that it utilized really the full skill set that we acquire in our surgical training: open surgery, minimally invasive surgery, robotic surgery, and endoscopy. I would start out with what symptoms you're having or what brings you into my office. Always I start with the patient story and perspective. I think that in this specialty in particular, establishing that rapport first is really important because the exam can be very sensitive. And so making the patient feel comfortable, understanding what their priorities are, and then kind of orienting them to the exam if that's necessary on that day before proceeding. We have a really outstanding team at Fairview, and I think that the multidisciplinary approach really enhances patient care. We have outstanding nursing care with experience specifically in colorectal surgery in the operating room. And what I would add is also that we have experience working in partnership with other subspecialty physicians and surgeons to provide holistic care that also is convenient for the patient if it means having two teams addressing a problem together. I think the patients who stand out are the ones who you develop a connection with, and in some way you impact their life at a moment when they need that. I enjoy cycling and being outdoors. I've been exploring the national parks and travel as well internationally. I lived abroad for a couple of years before my medical training, working in Paris, France, and that's a place that's very near and dear to my heart.